Sorry if my voice is a little hoarse. I was cheering on the Phillies yesterday and sort of lost it a little. It was a great game. Thank you very much for allowing me to speak. I'd like to thank Dr. Brucker and Ms. Bramnick for organizing really a world-class symposium today. So when you come into the office, a lot of different things happen to you. The first thing that we'll do, of course, is test your vision. We realize that the way that we have you test the vision by looking at single letters on a white background is not necessarily the way we use our vision at home. But it's an important thing, and it helps us gauge whether your vision's changing or no. With macular degeneration, there will be some day-to-day variability, as all of you experience. The second thing we'll often do is have you look at an Amsler grid. That Amsler grid is that checkerboard we give you, and what we're looking for there is whether there's any new blurry spots or new distortion. In many ways, macular degeneration, both the drusen as well as the wet type of macular degeneration that Dr. Sarin talked about, are sort of like that P in the Princess and the Pea story that we remember from when we were kids. For those of you who don't remember, there was this princess who, no matter how many mattresses you put on top of the P, could always feel that there was a P at the bottom of the mattresses. You can imagine then, using that analogy, that if there is something underneath the mattress, which is sort of like the macula, there'll be some distortion or a bump there. So one of the things that we'll ask you is, have you noticed any changes in the Amsler grid? And that'll also help us detect progression. Once you've gone through that, once we've looked at you, there's three different things we'll often order. One is a good old-fashioned color or fundus photograph, and that's just like a picture of the eye. The reason we get that is it helps us look for changes in the number or size of drusen, changes in the pigmentation of the retina, new bleeding or fluid from wet macular degeneration, as well as scarring of the retina. So that's just like a photo, and you look at it over time to see how things changed, just like when we look back at old photos to see how we've changed as time's gone on. The second test we'll often get is something called a fluorescein angiogram. The fluorescein angiogram is that dye test where we put this orange coloring into your arm and take a bunch of photographs of the eye. That's extraordinarily helpful for a few different reasons. What the fluorescein angiogram does is it tells us what the blood supply or the blood flow is like to the back of the eye. Of course, with wet macular degeneration, you get abnormal blood vessel growth. So the fluorescein angiogram will tell us where those blood vessels are growing from, tell us how large they are, and it'll also give us a sense of whether those blood vessels are still actively leaking, whether they're shrinking, or whether they've started to scar over. The second thing that the angiogram will do is it'll tell us what the retinal pigment epithelium is like. The RPE are sort of the cells that nourish the macula, specifically the rods and the cones. And as time goes on with macular degeneration, sometimes those RPE cells get damaged. And when they get damaged, they don't nourish the photoreceptors, the rods and cones, very well. So the fluorescein angiogram can be very helpful in that regard as well. Of course, whenever we do that test, we're always concerned about the possibility of allergy. But unlike different dyes that we may have had, either dyes looking at our heart, dyes for CAT scans or MRIs, the coloring we use for fluorescein angiography is generally much safer. Another concern that we have is, does it affect my kidneys because perhaps we have kidney disease? Generally speaking, no. Even people who are on dialysis can have that very safely. Of course, some folks, while they're getting those pictures, will feel warm or get an upset stomach. If that feeling occurs, it'll pass in a few moments. What everybody does notice afterwards is that your urine is the color of a pumpkin. This time of year, of course, is not such a big deal, being in the Halloween spirit. The next test that we get a lot is this OCT, and even a few years ago, we didn't do that very often. If you can imagine the macula as like a pizza, a color picture takes a look at the pizza straight on, gives you a sense of how many pepperonis are on there. What the OCT does is cut that pizza in half and tells us whether it's a thin crust or a deep dish. Also gives us a sense of what the bubbles are like, how much cheese, sauce, dough, and crust there is. So the OCT is very helpful to us in a lot of ways, especially when we're treating patients with wet macular degeneration. Of course, one of the main treatments that we have is Avastin and Lucentis, and Dr. Kaiser will talk to us a bit more about that. The purpose of those treatments is to get the wet macular degeneration to stop leaking. Leaking, just like if we had a broken pipe in the house, will cause things to become swollen. If once we had a broken faucet at home, flooded the kitchen, all the floorboards became warped and swollen and icky. What we're looking for is to see whether that ickiness or that swelling shrinks over time. And the OCT is very helpful. And for those of you who are getting Lucentis and Avastin, I wouldn't be surprised if you get an OCT basically every time you come in. As that technology improves, we can actually start seeing the individual cells of the retina, and that'll hopefully help us see what the health is like of the retina. There are a few other tests that we get, autofluorescence perhaps, but those are less common. So those are the main ones we'll talk about. Thank you very much for your attendance. We appreciate you taking time out of your day.